Hi, my name is Brandon Roth and I'm a student nurse here at Miles City College, and today we're going to demonstrate a subcutaneous insulin injection. First thing that we need to remember is the 6 rights to a patient. The right patient, the right medication, the right dose, the right route, the right time, and also the right documentation. That documentation will be done once we are finished. We are going to come and we're going to look at our physician's orders, which these orders have been transferred into our medication administration record, our MAR. The doctor has ordered that we give 20 units of intermediate lasting insulin, which is this one here, the NPH. We're also going to use a sliding scale for our quicker acting insulin. And the patient's glucose was 245 at 0700. 245 range is going to be 10 units. So now we are going to prepare the medication. We are going to use an insulin, 1 cc U100 insulin syringe. We are going to start out by checking the vials and making sure that there is no cracks or anything that seems out of place. These vials have already been used. They were dated and signed by the nurse who opened them. These have a 30-day expiration on them, so we are going to continue to use these. I'm going to slowly roll them through my hand. We do not want to shake them and get bubbles in either one of them, but we do want to mix them. Because they have already been opened, we don't need to pop off the tops, but we are going to take an alcohol swab and we are going to clean the tops off. I'm going to use a different portion of it. So because we are giving 10 units of the short acting and 20 units of the intermediate acting, the NPH, we are going to draw 30 units of air into our syringe. We are going to first start off with injecting 20 units into our NPH. We are now going to inject the last 10 units of air into our short acting. We are now going to turn at a 90-degree angle, and we are going to withdraw 10 units of our short acting insulin. We are now going to draw our intermediate of the NPH, and we're going to draw 20 for a total of 30 units of our 2 drugs. And make sure the air is out on both. I am now going to verify with another nurse. Well, first of all, I'm going to cap it with one hand. Maybe. There we go. We've now capped it. I am now going to verify the dosage with another nurse, and that we're at 30 units.
Looks good.
Now I'm going to go into our patient, to a skip rocker. I'm going to go into his room. I'm going to tell him that I am Brandon Roth, a student nurse, and that I'm here to inject his insulin for the day. I will start out by asking him for his name and his date of birth for a 2 identification. I'm then going to come over, I'm going to wash my hands, I'm going to dry them, and then I am going to put gloves on. After placing gloves on, I'm going to take another alcohol swab, and I'm going to come into the abdominal region. I am going to look and see where his last injections were and make sure that we do not inject into the same site or anywhere where the skin may be irritated. I will find the right site, and I will start in the center with the alcohol swab, and I will continue out in a circular motion. I've let the skin dry, and I am now going to pinch the skin, and holding the syringe like a dart, I am going to dart into the patient's skin, and I am going to slowly administer his insulin. At this moment, I'm going to walk over to the sharps because there is nothing in my path. I'm going to place the needle in the sharps container. Had there been any blood or residual of the insulin on the patient's skin, I would have dabbed that with a 4x4 or a 2x2 gauze, but we would never put pressure on or add a Band-Aid to that injection site. I am now going to document on here where the date the insulin was giving with my initials on both vials. I am also going to come over to the MAR and do the same thing. Student nurse, and it is 0700. And now we are done.